Yes, abuya. Ah. Ada muskil? Exit muna ako. Magme-medication, magme-meds lang ako.
Hi, Shell.
Ako na una sa
Yes!
May pasok na din kayo? May pasok ka na din sa school?
Yes.
Kulod.
Wala. Ano yan, te?
COVID.
Naku.
Wala, kukuha ko lang kahapon ng result ko. Negative naman ako.
Hindi, mag-vitamins ka lang.
Oo nga, lagi ako nagba-vitamin. Ito.
Hindi, mag-iba kang ano. No.
Ito.
Ang gawin mo, yung vitamins
Ito.
tablet by ascorbic acid.
Ito, pwede to.
Mga effective pa yan. Online mo ba yung binili, te?
Ha? Hindi. Mismo sa Virgil Drugstore.
Ito.
Parang Centrum daw to. O, parang Centrum. Yan, vitamin C. Saan yan? Nutritional.
Sa
Maganda
pharmacy
yan
po.
yung kay
Sa pharmacy,
1,000
saan?
milligram.
Oo.
Opo.
Saan yan?
Nabili ko lang po sa pharmacy. Yan lang na-recommend sa akin ng pharmacist.
Saan mga sa akin, Anita?
Sige
Magkano
po.
bili mo ganyan?
Ilang
Magkano
grams,
bili mo?
ilang grams ba
100.
yung Ate Romel?
Sa akin, 1,000 yun. Ito, 1,000 milligram. Vitamin C lang to.
100 po.
1,000 to. 1,000.
Kano ko ba binili ito?
1,000 milligram.
Yung isa, sinasabay nyo ba iniinom yung ano na yan sa isang
Hindi, isa
araw?
lang. Hindi, isa lang to. Isa ito,
Yung isang
ininom ko.
vitamins.
Ito kasi, may ano na to. Parang ano daw kasi to eh. Parang ano sa atin. Yung,
Good
ito
for
na daw
3
kasi
months,
yan
100 pieces.
Dapat ate, mag-focus ka muna dun sa sa tawag dito yung vitamins na isa, yung soluble. Huwag ka muna uminom ng isa kasi mag-focus ka muna sa one vitamins kasi pag lagi mong sinasabayan, maano ang kidney mo. Na-affect.
Ganun ba yun?
Masama din ng masobrahan ng vitamin C.
Oo. Saka yung liver mo, ingatan mo din kasi pag nasobra ng vitamins. Saka nasasayang din kung sasabayin mo yung dalawa. Iniihi mo lang yung iba dyan.
Oo nga.
Sayang lang.
Mm-mm.
Mag-focus ka muna sa isang vitamins.
Okay.
Para hindi halo-halo.
Mm-mm.
Nandiyan na yung delivery kong pagkain. Hi! Pagkain.
Galing ha. Deliver ka na lang ha. Dito wala nag-deliver, magluluto ka. Saan mo sa akin, Lukring?
Opo.
Magkano bili mo?
100.
Try na naman ang pagkain. easy.
Pero ano
Ang
po
sarap
siya,
naman yan.
100
Parang
tablets.
masarap ba yan? Dry. Lagi na lang araw-araw.
Good for
ganito.
3 months.
Ganun. Good for 3 months na yon.
Opo, parang tigwa 1 dirham each.
Ay, okay na, no? Oo,
Opo.
okay na.
Kakamayin. Tsara. Ay, exit muna ako. Ako'y magpapainom.
Kain ka na muna, Frank.
Yes, Kuya. Yes, Kuya. Assalamualaikum.
Kaya ako po send, ate ha. Busy pa po ako magsulat ng mga estudyante ko. Mamaya ako po si-send.
Okay lang, no problem,
May
Ben.
susunod-sulat pa.
Sige lang, sige lang.
Sige po.
Take your time.
Ada muskil? Ha? Wait.
Ano?
Kuya, abuya? Abuya? Ha? Insintetik abuya? Ayaw. Sa kuya? Oh, nada. Good? Good? Say? Huh? Say?
Asa na si Ma'am,
Alhamdulillah.
Sherlo, wala na. Nawala na.
Ayun na. Ha? Nadinong-dong te baden mo. Ay, buya.
Ayaw minom ng gamot. Badan.
Ada sui-sui. Ada sabuya. Ya. Check down.
Thank you, Romile. Thank you, Ma'am Yong. Dali lang, anong picture.
Okay. Class.
Nako. Okay. Continuation. Sana tayo tapos equivalence. Tapos na. So, dito na po tayo sa coagulants. Ay, hindi pa pala. Ito sa kanina. Or
Yan
fungal.
sa antifungal.
Fungal, okay. So, yung antispasmodic naman, eto pag it relieve from spasmodic pain or spasm of the muscle. Like for example, pag yung patient masyado yung nag-chill siya or any muscles na yung may involuntary movement, we usually give to the patient yung antispasmodic medication. And antiemetics naman, it relieves or prevent nausea and vomiting. So nagbibigay tayo ng mga antiemetics which may mga available inom natin. And also anti-tubercular, ito yung ginagamit to treat tuberculosis. And coagulant also, it helps in the coagulation of blood. And then another thing is that carminatives, which ito yung mga drugs expulsion of gas from and intestine. We usually give this one. And diaphoresis also is for the action of sweat glands. Like for example, like for example, yung secretion ng fluid mo, masyado na siyang so they will give you diaphoretic medicine. And also, diuretics, which is increase the flow of urine. Like for example, you have difficulty of urination like that, so they will increase for you, they will give you anti-diuretics medicine for you to have this flow of urine. And detergents also, it is a cleansing agent also. And digestion, it is an agent for digestion. So, if you have problem about your digestion, it promotes para maanahan yung digestion system mo. Number 26 is that emetics also, this that will produce you to vomit. Like for example, they want you to vomit or they want you to clean something about you, so they will give you anti-emetics pala. But the one if kung gusto nila na yung kasi dito it produce you para mag-vomit ka. Meron naman para hindi ka kung nagba-vomit ka, pahintuin yung anti-emetics naman siya. So, ecbolaric or exotoxic, ito yung mga drug na nag-stimulate during contraction. Kadalasan ito, binibigay ito yung oxytoxic during delivery para mag-contract yung uterus ng patient natin para manganak siya. And then also, we have expectorant. to increase bronchial secretion and aids for the expulsion of mucus. Like for example, we have a dry cough. So they are giving you this expectorant para yung bronchals mo, yung mag-secrete siya at aids you to para lumabas yung mga mucous membrane mo. And emollient also, it is a substance that is smoothen, it soften, and it protects your skin. Ito ina-apply sa skin. And galactogog, which is a substance that increase the flow of milk. Like for example, there is a mother na gusto magpa-breastfeed and then still heavy pa rin yung ano niya, yung breast niya, it cannot release. So i-recommend ng OB niya to have this galactogog na iinumin niyang mother. Para mag-secrete siya ng milk niya. And anti-hypnotics also, it is a drug that produces sleep. If you have a difficulty of sleep, mahirapan ka matulog, they usually give you anti-hypnotics medicine. And also for hemostatics, which is an agent to check the hemorrhage also. Binibigay yan. And hypotensive, if any patient having a substance that can lower the blood pressure. Kunwari, pag mataas ang BP mo, usually binibigay nila ng medication sa'yo ay hypotensive para mabubaba yung blood pressure mo. So, bibigyan ka ng hypotensive medicine.
Hypnotic. Ano yun?
Hypnotics?
Parang yung ano ma'am, parang kayat kitayapin.
Oo, ganun. So, another thing is that yung hypoglycemic, which is ito yung mga medication na binibigay din para pag mataas yung blood sugar level mo, binibigyan ka ng gamot ng hypoglycemic para bumaba yung blood sugar level mo. And to yung high maintenance medicine, ito yung naman yung agent that tends to increase the hemoglobin content of the blood. Kunwari, pag mababa yung yung hemoglobin mo, so bibigyan ka nito ng gamot na ito, yung high maintenance agent. Binibigay sa iyo yan. Another thing is that yung pediatrics, kadalasan ito binibigay sa eye clinic or sa mga which delay yung pupil ng eyes mo para ma-delay siya, para kadalasan sa eye clinic ito na ginagawa para ma-check yung ma-relax yung mga muscles mo din sa eye. And then you have the nasal decongestant, which is it relieve yung nasal congestion. Kung kunwari, halos hindi ka na makahinga, full na yung may running nose ka. So, you have to take this nasal decongestant para ma-relieve yung congested nose mo. And narcotics, this is the drug that produce stupor or complete insensitivity. So, they are giving this one. Kadalasan ng mga narcotic drugs, it has also need for the prescription of the doctor. And then, scabies, ito naman, treatment for mga scabies patient. Yung mga meron silang scabies. And sedatives, also any substance that lessen the body activity. So, binibigay yung sedatives para ma-less yung activity mo. Kunwari, ma-sedate ka. Another thing is that stimulant, it increase functional activity of an organ or system. And then, vesicant, it's also a blistering agent. And vasodilators, it's a drug that dilate the blood vessels and lowering also the blood pressure. Kadalasan ito kasabay ng ng hypotensive medicine and vasodilators. Ibinibigay nila sa mga patient na who have this hypertensive patient. And vasoconstrictor naman, ito yung drug that constrict the blood vessel and rising of blood pressure. Pag mababa naman ang binibigay ito para mag-rise yung blood pressure mo. Now, we have different classification of drugs, which is to promote the patient functional health. this one, it depends upon the function of the drugs that we have, which is the health pattern activities, and exercise. We usually give this up for the patient with antihypertensive, antiarrhythmias, anti-angina, and anticoagulant also. And for the drug for nutrition and metabolism, we give antibiotics, antiemetics, antacid.
Teacher, yung
And
slide po, hindi po makita yung natatakpan ata, yung iba, sa
oo
slide.
nga eh, yung ginawa, ginawa ng anak ko, ganyan.
Oo, hindi makita.
Hayaan mo, itong slides, i-share ko na lang sa inyo after this. And then we have also health pattern for elimination. Kunwari hindi ka makatae, meron siyang classification with laxative para ilabas mo, anti-diarrhea and anti-diuretics also. And drugs that can cause sleep, rest, cognition and perception, sedatives, antihypnotics, analgesic. And also a health pattern coping with stress tolerance, like for example, anti-anxiety agent or antidepressant agent. And the drugs that for sexuality and reproductive, which is the ovarian hormones. These are classification of drugs that to promote patient functional health pattern. Now, there are different sources of information about the medication, but a fundamental rules of safe administration of drug is that you never give medication to the patient which is unfamiliar. Kung hindi nyo alam yung medication that you have with you, you have to ask. Very important to ask. If nobody with you, never administer medication. And then also, there is a system of medication distribution, which is yung unit dose supply, yung packaging ng individual patient, yung dose given in the time of administration also. And also the self-administered supply, which is yung each medication is supplied and separate container is used only for a one client medication, hindi yung medication na yung self. Pag mag-administer ka, it is mixed. It should be one patient in one medication and can be stored for the patient bedside only. You could check for the bedside medication of your patient sa tabi lang niya. Merong isang maliit na cabinet doon. Tignan niyo, andun medicine ng patient. But some, if you are inpatient, you could see that one sa nurses station. And it is also enabled for a self-administration. Now, there are systemic distribution, which is 4 types niya. Number 1 is that the stock supply, it is a large quantity medication and stored in a pack cup covered sa storage niya. Kadalasan, ang medication distribution is you could usually see sa stock supply ng hospital, or you could see in the unit dose supply. Meron tayong isang unit na bukod dun sa pinaka-main stock natin, meron pa tayong unit stock na pag kukuhanan mo sa patient natin, packaging of individual patient na, like for example, per room siya, pero may maliit na box na kukunin mo siya, andun lahat ng medication for patient, and it's also there the patient dose and time of administration. And another thing is that the automated medication dispensing system, which is by method, yung nurses can obtain desired medication from the menu, and the system help to keep an account of all medication using and billing controlled substance. Kadalasan ito naman kasama na siya sa pharmacy, mag-order sila for. Actually, this one is for the setting for the hospital also. And self-administered supply, each medication supplied by separate container. Kunwari, binibili ng patient yung gamot niya, and they could store in the bedside of the patient. Ayun yung distribution ng kadalasan na different types of medication distribution. It's either na you could get from the stock room or in the unit, or meaning to say sa nurses station, ganun, kunwari kung nasa medical surgical ka, ganun, or like for example, operating room or nasa ward ka, ganun. It's a unit na may siya, yun yung unit supply, or automated dispense from the main pharmacy like that, and self-administered supply, you have to buy for that one. Marami. Now, there are different kind of prescription. Now, the prescription medication, it's an illegal order for the preparation and administration of medication. This requires medical supervision because it is dangerous side effects. Kadalasan ng prescription na prescribed medicine, it is there is a side effect for the patient. And there is also a non-prescription medication. Many medications are available without specific written orders from the healthcare provider. You also they can consider safe and directed as it dangerous and misuse also, since it can cause side effects also. Sometimes there are non-prescription medication that we are yung binibili na, tapos mamaya tinake na natin, and then it can cause already side effects for that one. The medication order, which is yung prescription of medication, convey an order with the following components. Like for example, there is a name, patient name, there is an identification medical number or file number of the patient, there is a medication name, again, and then for the medicine, and then the amount and dosage of the medicine, and then route of administration, meaning to say how will you given it. Kunwari, bibigay mo by oral or by injection, intravenous injection, or by suppository, or different types of administration. And then also there is a signature of healthcare provider. And when you put that one, there is also an abbreviation when to take this medication. So there are some important abbreviation that we have to know also, especially when we work sa hospital or kunwari sa mga nurses home also, they use it like an abbreviation. Like for example, yung kadalasan yung abbreviation, eto siya, AC, gano'n. Yung derivation, eto kadalasan, ano siya, parang Latin word ba? And we have the meaning. Yung AC, ang kadalasan ito before meal. So if the doctor require for a medication, like for example, ibuprofen or before, or any medicine na pag nilagay niya sa dulo, like for example, AC before ng mga ferrosulfate AC. So you have to take this medication before the patient have to take the meal, or it can be taken at empty stomach. Like for example, yung mga antacid, ganun. And PC, yung PC, hindi ko nababasahin yung kung saan yung posible, yung ganun. PC, which is kadalasan after meal. Usually this one, we are taking this one medication, lalo na pag hypersensitive yung yung may ulcer ka, ganun. So, ni-require ng patient na you have this medication to take this one, PC. Kadalasan ito yung mga PC notes ng mga nasa medical term. So, yung PC, AC, ganun. Ang PC, which is after meal. Ang AM naman, ito naman ay before noon. So, yung na siya, mga 12 o'clock mo siya ibigay. So, you have to give this medication before noon, or PM, or afternoon, or alt-day, meaning to say alternate day. Or OM, which is each morning, you have to give that medication. Or OD, which is daily or once a day. or HS. Ang HS dito, hindi po pwedeng small letter. Kadalasan particular kasi pagka sa mga abbreviation, dapat kung ano yung nakalagay, yun lang. Huwag ika-capitalize lahat. So pag HS, capital letter, meaning to say at bedtime. And yung PRN, ibig sabihin when required. Kung kailangan mo mag-take ng gamot na yan, so you have to take that one. So if you are in pain, imbes na mamaya ka pa uminom ng gamot na yan, iti-take mo na siya. Kasi kailangan mo na. So you required to take that medication.
As needed.
Oo. So yung another thing is SOS, which is when necessary in emergency. Ayan po yung niya. And also for BD or BID, ibig sabihin twice a day. And TID means 3 times a day. Yung stat naman, pag sinabing stat, at once or agad-agad mo ibibigay yung gamot. Or ON, each night. Yan ang mga abbreviation na ginagamit sa hospital or lalo na pag tinignan mo yung medication form ng patient, andyan yung mga abbreviation na yan. Now, there are different orders that na ino-order ng mga doctor, which we have the standing order, we have the PRN order, we have ang standing order pala, yan ay pinaka-standard na kailangan you have to take this order. You have to take this medication. Or PRN
Di ba,
order,
ma'am?
meaning...
Ma'am, di ba yung mga abbreviation usually nakikita yan
Sige lang.
sa daily nursing plan?
Medication.
Yung
Oo,
abbreviation.
Oo. At saka kung minsan din sa abbreviation. O kung minsan din sa doctor's order, nilalagay niya doon. Tapos, kung sino yung nurse na mag-convey, na mag-execute ng order, isusulat din niya doon. Tapos, pagka may mga hindi ko lang alam kung pag sa alang-alam ko ata pag nagde-delegate din sila yung mga ibang yung sa mga gamot ba, pag delegation ba ng katulad mo diyan, nag-ano ka ba ng gamot? Nagbibigay ka ba?
Opo.
Frank, nagbibigay ka ng gamot? Oo. Like for example, pag sa mga house case ka, liable ka sa mga medication ng patient mo. So, ilalagay mo doon kung ibinigay mo o hindi. Andoon yun sa medication sheet ng patient mo.
Tapos
So, ano yung mga medicine na tinitake niya?
Sa nursing note, sinusulat din.
Oo. Isusulat mo rin yun. Oo. Isusulat mo doon kung binigay mo ba yung gamot. Kung hindi mo binigay yung gamot, bakit? You have to give the reason. Kunwari, the patient refused. O kunwari, naging toxic ka na or something happened na beyond control. Basta, i-take down notes mo sa nursing station, nurse's note mo, sa note mo na hindi mo na imigay yung medication ng patient mo para yung next shift na papalit sa iyo, iko-continue na yung treatment na hindi mo na ibigay. And another thing is that yung bukod sa standing orders, you have the PRN orders. If suddenly the patient has a pain, is in pain, so the doctors will give you per necessary order. Or kunwari, na-feel niya na masakit yung so you give PRN medication. So you have to give painkillers for the patient. Or there is a one-time or single order. Like for example, pupunta ka sa you are for operating room or kaya yung patient mo ay kailangan maggagawa ng diagnostic procedure. So, kailangan niya ng uminom ng isang one-time medication or single order na medication for that thing. Or there is also a stop order. Like for example, yung patient natin ay masyadong mataas ang blood pressure niya. Tapos kailangan mong kahit na kung wala man doon sa sa gamot niya yung so mag-order ng start emergency medication for the patient to lower the blood pressure of the patient. Kung yung emergency o kaya agad yun yung stop order,
Yes, sir.
emergency na talagang now na.
Inaano ko
And
na,
there is also
pinapile ko na yung mga
telephone,
ano,
verbal, fax, or
pinapile ko na
online.
siya kasi pipick upin bukas ng driver yata yung ano natin, reports.
So,
Sige, sir.
that's it. Another thing, we should remember that every medication na tinitake natin, there is an effect sa ating katawan. So, number one is that when you take a medication, there is a therapeutic effect. This effect which desire to, ito yung desire or reason kung bakit tayo nag-take ng medication. So, therapeutic effects mean the medication that you are taking ay yung kung ano yung desire mo na mangyari at saka intentional na effect na ini-expect mo na mangyari ay gagawin niya, isosolve niya. Like for example, the drug that are administered for the following. So, the promotion of health, like for example, nag-take ka ng vitamins kasi may therapeutic effect yan. Alam mo na ang vitamin C, like vitamin C, maganda sa skin natin. Or to prevent disease. Like for example, yung mga antitoxin o kaya yung mga vaccine. So, nagtitake tayo niyan para mapreventahan natin yung katulad ng mga flu, ganon. So, we have to have this flu vaccine. Or we need also this therapeutic effect because it has we need to diagnose the disease. Like for example, a patient will go to CT scan. He has to take a barium or barium X-ray. He has to take this, magti-take siya ng anything na i-induce sa kanya para to diagnose kung ano ba yung sakit niya. Or this therapeutic effect also alleviate the disease. Kunwari, they are giving you para mawala yung sakit. It can cause analgesic. It's also to treat or cure disease like for example, yung mga malaria. Umiinom tayo ng gamot para gagaling tayo sa sakit ng malaria or TB. So, ayun yung para matreat yung TB. So, ayun ang ibig sabihin ng therapeutic effect. Kung uminom ka ng gamot na ito, yung expected outcome mo ay gagaling at mamimit. Ibig sabihin, yung reason talaga ng gamot na yan ay yun yung effect niya sa iyo. And there's also a local or systemic effect. Yung local effect are expected when they are applied topically to the skin. And a drug is used for systemic to be absorbed into the bloodstream to produce desired effect on various systems and parts of the body. So pag ang local lang, kadalasan yung local na inaano, yung mga ina-apply lang natin sa skin, mga topical medication like that. Pag systemic naman, kadalasan ito yung mga drug na tinitake natin and then nag-undergone siya ng process sa systemic natin. Like for example, sa liver natin, digestive system natin, sa iba't ibang part ng katawan natin. So, ayun, yung local is topical and systemic is you have to take it internally para yung system mo will have his effect of the body or in the system. And also the adverse